you can make your estrogens. So you have three main forms: estrone, E1, estradiol, E2, and estriol, E3. Those are the three main hormones that are running our bodies. Estradiol is that growth hormone that's responsible for reproduction. So it grows the lining of your uterus every month, and hopefully you have progesterone to keep that in check. But as you can see, it can turn into estriol or estrone. Estrone is also not only made by your ovaries, but also by your fat cells. And too much estrone is a bad thing. So we want to make sure that we don't have too much estrone around, because that can go down to increase our risk of breast and uterine cancer, as I'm going to explain in a minute. And if you notice on this picture here, testosterone can get aromatized to estradiol or estrone. And in fat cells, it almost always gets aromatized into estrone. So women who carry extra fat cells on their body and can't release that weight, they are more prone to having too much bad estrone. And that is why obesity is a risk factor for uterine cancer and breast cancer. It's this situation right here. So you're making these levels. In this sample case, it's way too much. You should not be all the way far to the right. If you look all the way far to the left, you see this purple area. That is a menopausal level. And so that would be super low. So what happens is estradiol, our main reproductive hormone, gets turned into estrone. Estrone goes down one of three pathways. And that's what we're going to talk about. Or estradiol gets made into estriol and can go down this intermediate pathway of 16-hydroxyestrone. So things are always shifting and changing your hormones. So when you do blood work, oftentimes a doctor will just measure an estrogen level. For the lab that you get drawn at, that could mean they're measuring all three of these estrogens, or it might be just the estradiol. It's sometimes hard to know. You can specifically ask for estradiol, estrone, and estriol, and those will give you the levels. So what we see here is estrone gets metabolized down this 2-hydroxyestrone pathway, which is the most protective pathway. That means it went through phase 1 of the liver detoxification process appropriately, and your body inactivated it so that you can hopefully remove it from the body. It can go down this blue pathway, which causes this intermediate of 16-hydroxyestrone. This intermediate can be a bad carcinogenic intermediate form. And so we don't like it to be too high in this case, because then it can get reabsorbed. So we don't want too much reabsorption either. And we don't want to go down the red pathway, which causes 4-hydroxyestrone. 4-hydroxyestrone can damage the DNA in our cells and increase our risk of cancer. So this Dutch test shows a nice pie chart with the different percentages of how your estrogen got metabolized during the phase 1 process of your liver. And you do not want more than 11% of that going down the red pathway. If that is the case, we need to get you on some major antioxidants. We need to be eating brightly colored vegetables and fruit, and taking NAC and helping glutathione production. Glutathiones are a major antioxidant that goes around and cleans house, gets rid of all that broken DNA and damaged cells so they can't go rogue and cause cancer. So if this quinone reaction is happening down this toxic pathway, it's really important to know and take action. You can also support this green pathway, this phase 1 detoxification through the liver, by pushing this 4-hydroxyestrone over to the green pathway. And you do that by making sure that the 4-hydroxy, you make sure by making sure the liver detox pathway is functioning well. And that looks like eating enough cruciferous vegetables like broccoli, Brussels sprouts, cauliflower, cabbage, bok choy, because they have compounds in them called diindolylmethane and indole 3 carbinol. Those compounds help phase 1 of the liver so that you can get your estrogens through that process to get deactivated. So I encourage women, if you have too much of this 4-hydroxy or too much estrogen overall with symptoms of estrogen dominance, to take DIM and indole 3 carbinol. DIM, diindolylmethane, can be found in supplement form, and it can be very effective at pushing more estrogens down the green pathway so that fewer are going down the red pathway.